common questions I get asked by patients is, why am I not doing a biopsy or a test to investigate my rash? And the truth of the matter is the vast majority of rashes can be diagnosed from a careful clinical history and examination. So that's listening to what the patient has to say and looking carefully at their skin complaint. The first element I'd like to talk about is clinical examination. And this really requires three elements: good exposure of the patient, so you're seeing the whole rash; good clinical lighting, so we're able to identify the colors that are important for that rash; and good magnification. And we use tools such as clinical lamps and magnifying glasses and dermatoscopes in order to get that good lighting and magnification. And remember, the skin is an organ that is very close to the surface, so most of the features are visible to the naked eye. Whereas in cardiology, when you're investigating the heart or the liver, these are obviously organs that cannot be directly inspected. The second element of that is good history taking. So this is really taking the time to listen to the patient's story about what's happened with a rash, how it's developed, and then gradually then honing in and asking more specific questions that will lead to clinching the diagnosis. The vast majority of diagnoses can be obtained through this simple, age-long process of clinical history and examination. But for certain more complex and rare and unusual rashes, further investigation such as blood tests or a skin biopsy may be needed. The vast majority of rashes are easy to diagnose based on clinical examination and history taking. There are three categories I like to think of. The first is where the patient and everyone else really knows the diagnosis. They've had this rash for a long time and they're interested in the treatment and management of that rash. The second category of patient is where they don't know the answer, but the dermatologist, through clinical history and examination, can quickly arrive at the diagnosis by looking at the pattern of the rash and the morphology and having that bank of experience of dealing with a variety of skin rashes. Some more challenging rashes can be more difficult and require further thought, investigation, or follow-up. Now, these are often rashes that are more unusual in nature, or rashes that can commonly mimic other skin conditions and overlap with them as well. Other reasons why rashes can be difficult is if rashes are partially treated, that removes some of the diagnostic features. And also, we must remember that skin rashes, like living things, have lives. And we call this the lives of lesions. So the very beginning phase of a rash, often many different rashes can look very similar in that very early stage. And it's when it's often given time to develop and mature, we can see some of the more characteristic diagnostic features of the rash emerging. And then at the very end, in the end stage of a rash, when it's normalizing, going back to normal skin, again, this is where a rash becomes very diagnostically difficult. This is why often we follow up patients, often we ask for pictures which are incredibly useful for when the rash was at a different stage, so we can see the whole evolution and the lives of the rash. And in some cases, even despite those careful clinical history and examination techniques, we do need to perform an extra biopsy to look at the microscopic details of the rash in order to gain further information that can help us get to the right diagnosis.